Well, hello everyone. You are in for a special treat on tonight on behalf of Praise Temple. We have a special group of panelists, of medical professionals, attorneys that are going to be bringing some great information to you on tonight. And we hope that you enjoy our panel discussion. And of course, if you have any questions that you would like for us to answer, please feel free to comment. And if we're unable to answer those questions tonight, we will make sure to get back with you as soon as possible. Well, I want to start by first introducing myself. My name is Latoya Williams. I'm an LPN, and I also have about 11 years of experience as an LPN. And I'm going to be introducing our other panelists on tonight. Here tonight, we have Dr. Jaya McSharma. She's a medical doctor at Christus Health, and she's a medical doctor and hospitalist. We also have attorney Stuart Crichton. He is an attorney with Gregoria, Chafin, Johnson, Tabor, and Fanasi. Please forgive me if I mispronounced the name. And he's also the co-founder of Arklatex 3D Technology, LLC. We also have Mrs. Janie Phillips, registered nurse, with a master's in psychology and Christian counseling. We have Miss Angie Pellerin, she's an LPC, and also Mrs. Alicia Mingo, LPN, with some wonderful credentials that if she wants to expound on, welcome to do that yourself. Anyway, you're in for a treat tonight. I'm so excited, and thank you all again for joining in for our discussion. We're going to go ahead and get started. Dr. McSharma, I'm going to start with you. I want to know, of course, COVID-19 is something that we're hearing on a daily. Every time you turn on the television, we're talking about COVID-19, and people are nervous. But of course, the states are starting to open up, some of the cities, some of the states, and of course, we're hearing different cases. The numbers are going up. And so just wanted to hear, currently, do you know if there is a vaccine available at this time?
Yeah, and thank you all for having me. Thank you so much, Latoya, for having me on this call. Hi, everybody. I am Dr. McSharma, and I just wanted to say thank you for having me on the call again. And I'm going to talk to y'all like I would talk to my family, with my medical knowledge and expertise and what I've seen. But anything that I say should always not be substituted for the advice of your own physician. I just have to say that, I think, once to get that out there. Unfortunately, there is not a vaccine yet. There are several companies, 3 in particular, that are developing vaccines and even moving into phase 3 trials. And they start that with about 20,000 people. So it's going to take some time to see how those people react, side effects, effectiveness, things like that, before it's going to be available to the general public. So there is no vaccine available currently, and they're estimating a timeline of up to a year before there's one that's available to the general public, and maybe even longer, but currently no vaccine.
Okay, wow, and that's pretty scary. I know it normally takes at least 10 years, I've heard, for them to even get a vaccination for a virus. And so we really have to be mindful of that as well. Since we're talking about COVID, I want to know, of course, a lot of people that have had COVID, I often find myself being asked the question, can I get the COVID virus again? What is your stance on that, Dr. McSharma?
Yeah, that's an excellent question. It's been rare, but we have seen people who have gotten COVID a second time. Unfortunately, the data is changing so much that sometimes it's hard to know, did they just never fully recover from the initial infection, or are they actually being sick a second time? Because the symptoms from the disease can last up to 2 to 4 weeks, right? So it could just be that you never got over that initial infection. So unfortunately, once you recover from COVID, it doesn't mean 100% that you cannot get it again. So you should continue to be just as vigilant if you've recovered from it as you were before getting it, the first time. I wouldn't relax your defenses.
Absolutely. Absolutely. Thank you so very much for answering that for us tonight. Being that I've worked in the geriatric community for a long time, long-term care, we know that population is very sensitive, and a lot of employees and staff members have been infected, and of course, that elderly population have been affected. And so, Attorney Crichton, I wanted to know if at this time, are there any specific guidelines for communities such as nursing homes, hospitals, homeless shelters that are implemented currently?
Hi, Stuart Crichton. Same statement as Jaya. Please don't substitute my advice for that of your own attorney or your medical doctor or a field director with a medical background. But there are the CDC, Department of Labor, the Louisiana Department of Health, and a lot of other organizations have really good guidelines or have guidelines in place. Now, they aren't always up to date with the science. So if you are a medical professional and you have a deeper knowledge and you feel like the science has surpassed what's happened, I would suggest consulting with the attorney for your organization and seeing how best to protect your staff. Because the science and the law are not keeping pace with one another. And there's also an attitudinal issue of what's easier and best for my residents that they can process. Yeah. And we can do it consistently, because we don't want something to be perfect for a day and have everything collapse because it's unsustainable. So Department of Labor, OSHA, that's the Occupational Safety Health Administration, the Centers for Disease Control, the WHO has good advice, and various state organizations. But I would suggest at the very least adhering to the minimum standards set by the local, state, and federal government for your particular occupation.
Thank you so much for the information, Attorney Stewart. I also want to I don't know if this is off subject per se, but there's something that personally happened to myself and my husband recently. We were in the store, of course, wearing the appropriate PPE, and we saw someone that we knew personally, and she wasn't wearing a mask, but she verbally told us that, hey, I've been diagnosed with COVID. And of course, we freaked out because she's in the store, she's not wearing PPE, but the fact that she was out in the general public just kind of freaked us out. And so one of the questions I want to know personally is, if I were to get COVID, especially the first thing I would think was, did she give it to me or my husband and expose us to it? Could I seek legal counsel if I were to, get COVID and thought that maybe this person opened it up for me to get it?
So the first thing I'd like to say is that if you are exposed to COVID in that situation, one of the things you should do is always consult with your personal physician, do that. You are contagious. And if you are going out, you are exposing other people. And that is a selfish act that is bad for you, it's bad for me, and you might be hurting a lot of people. No one wants to be a typhoid Mary and spread a virus to the people they care about and to their community. The second thing is that, it's hard to say. I need to know, with any kind of exposure case, just given how unique this is, all the facts. But if someone contacts our office and says, this is a situation, we're going to want to set up a consultation with them. Obviously, we want to make sure that person is clean so we don't expose people in our office who might be vulnerable to disease. Right. And we have safety protocols in place for that. But we would research it based on the law. Recently, as of today, my understanding is that Governor John Bel Edwards signed a bill into law that deals with limiting the liability for COVID exposure. That is, when an organization or business doesn't provide the right safety standards, something like that. And I'm still kind of going through it. Its language is, there's some questions about its language and its applicability, but I believe if someone intentionally exposes themselves or another person to COVID, there's a strong likelihood that they expose themselves to the legal consequences. Now, the real question you have to ask is, was that person acting for someone, or are they someone who can actually pay for that, or who can pay for the damages or be financially responsible for those actions? Most people can't, but really it's institutions that if they're forcing someone to come to work that is COVID positive, that's dangerous. And I think we need to start holding people accountable and behaving ethically, because if we don't, the consequences could be dire.
Absolutely. Thank you so much. We appreciate that response, sir. Going on to our next question. a lot of African Americans are dying from COVID-19, and of course, it's a sad situation, but it's true. And so, of course, Dr. McSharma or any of our nurses, Alicia, Elder Phillips, please feel free to expound on it. Why do you think the African American community are dying from this particular virus?
Well, I can start, and then maybe Alicia and Miss Janie could jump on. Just from my perspective, well, so complicated. But, I would say that's a couple of things going on there. The first thing is that, epidemiologically speaking, a lot of African Americans have a stronger predisposition towards things like high blood pressure or kidney disease or diabetes. Those are all risk factors for complications from COVID. Basically, to put it plainly, if you have any of those conditions, there's a higher risk that you will have a more serious consequence if you get infected with coronavirus. So that's certainly part of it. And I do want to say, if you have any of those conditions, I don't want you to say to yourself, well, I'm screwed. What can I do? Because if you are someone who has high blood pressure or diabetes or renal kidney disease, but you're doing everything you can to make sure that those conditions are well controlled, you're in a much better state than someone who isn't. So it really does matter. Is your blood pressure controlled or is it uncontrolled? The second and third parts of that, maybe the other guests could speak more to. I think there's a lot of distrust in my experience with the African American community and the medical community. And that's something that I personally feel passionate about, that we need to build a stronger bond. Because I think sometimes with some of my patients and friends, they say, it really seems like y'all say one thing one day and another thing the next day, and it feels like we can't trust you. And I just want to say, in this particular case, that's because the information is changing so frequently. It may seem like we're changing, but we're just trying to stay up to date as the information on a brand new virus changes. And then the third thing is access to good health care, and we could talk about that.
Correct.
But Alicia and Miss Janie, I'd love to hear what y'all have to say about that as well.
Well, I would like to just kind of tag on to what you were saying about the overall health of some African Americans. First and foremost, the heart disease, the comorbidities such as diabetes, and then hypertension, and then there are other suppressed conditions that a lot of African Americans have. However, sometimes African Americans are less likely to seek medical help and try to self-medicate at home. And then sometimes I've seen where African Americans don't take the necessary precautions, such as washing the hands, something that seems, you may think it's very simple, but hand washing is the single most effective way to prevent cross-contamination by hands. And of course, the wearing of the mask. They are readily accessible now as opposed to in April and May when it was difficult to obtain the necessary PPE. But a lot of African Americans, I think their overall health condition is what puts us at greater risk, because we really don't take care of ourselves. We don't do follow-up appointments with physicians. And to just address something quickly with getting the COVID testing, I knew of a young lady who wanted to get tested, and this happened in late May when everybody was really trying to get tested. And she called our local hospital, Ochsner's, and Ochsner's they got her information and referred her to a physician to refer her to whatever facility was performing the COVID testing. And she really kind of got the runaround because she didn't have all the classic symptoms. And yet she felt as though she needed to have been tested. She had sore throat, a low-grade fever, but yet they didn't follow through with her, and she never got tested through Ochsner. She ended up going through to a quick care clinic. So those are some of the areas that I guess everyone needs to be aware of, that African Americans, sometimes you just have to encourage yourself to go on, seek help wherever you can get it. If you don't get it at hospital A, then go to hospital B. And Of course, with the quick care, she may have to pay, but it's worth it. Alicia, you want to address something?
Sure. There were a couple of things that I did want to add on to that. And Toya asked about some of my certifications. So I'm a LPN CC, which I actually do clinical coordination, and I'm a case manager. I am also a certified child care health consultant for the state of Louisiana. So a few things I did want to touch on what Attorney Crichton said was that there was basically, I'm sorry, I was trying to make little notes everywhere. But as far as job is concerned, there are quite a few people, especially African-American younger people, who are in jobs that require some type of service, whether some type of public service, whether it be a police officer, a nurse, the young lady working at McDonald's to pay for college. I mean, it's a higher rate there. And then you also have jobs that require you to come to work even though you're sick. And so that was one of the things that he was mentioning. So I know for my job, we were required to report if we were having any type of symptoms. But then I've heard that there were other facilities, whether you had symptoms or not, they expected you to come to work. They expected you to clock in and do your job when it was very possible, and I mean, really highly, that you possibly had COVID-19 or that, you were symptomatic. And so I think taking a step back as well and holding some of those corporations or companies accountable for when they're doing things like that. One of the things that our company has done also is that you have to self-report. And so it's not necessarily you self-report to your immediate supervisor, you self-report to the HR department. So you have something on file that says, hey, I said I was sick, I said I wasn't feeling well. So when you have patients or people that have come through your drive-through that have contracted COVID-19, you do have a paper trail of what's going on there. One of the other things I wanted to hit on with what Dr. McSharma mentioned was that there is a distrust, and sometimes I believe there's a misunderstanding between some of the African-American community as well as physicians. And I mean, if you look through history, there is plenty of information why African-Americans would have a right to be concerned about the information that they're receiving. Because at one point they were used as test specimens, I mean, I'll just put it out there. And then also people have come into the general knowledge that hospitals and physicians do have contracts with pharmaceutical companies. So sometimes when there is a drug that is not necessarily beneficial for the African-American community, that medication is still prescribed. So there is I won't say a great divide, but there is certainly distrust. And I often find myself in the middle of trying to convince my patients to seek help, or this is why the doctor said this, and this is why this is beneficial to you. So a lot of the times I find myself having to bridge the gap there. And there was one other thing why I think we are getting it at such a higher rate. And I'm sorry, I'm trying to move it along, but it was just a couple of things that I felt were really important there. Initially, when COVID-19 or coronavirus, and what else is it being called, SARS-2, was discovered across, in other countries, I don't think that our country took it as serious as it should have, because sometimes we feel like when it's not over here, it's not knocking on our door, so we're okay. So therefore, we did not properly prepare. People were reporting signs of things going on with them as early as late November. And look at the amount of time that it took us to actually get prepared to even do testing. And then we still weren't able to test as needed, like as necessary. And on the other side, people are having to, if you have insurance, you have to pay a copay. I know, for example, my copay, if I decide to go to a quick care, my copay is $150. If I decide to go to the emergency room, it's $400. Okay. So again, you have that working class, you have people with families, with children, and they are trying to provide for their meals. They're trying to provide for housing, transportation, and all of these things. And so, as Elder Phillips mentioned, you have a lot of people, especially, African-American people, and not just African-American people, but people that are in that working class, that are in the poverty level, which Louisiana has a great big amount of people in poverty, And so they would rather self-medicate, try some old remedies, take Tylenol, and feel like, oh, they're getting better. Because I've heard a lot of reports of you feel bad one day or a few days, and then it goes away. And then it comes back, and then it goes away. And so there were also quite a few people that don't have any predisposing illnesses or anything like that have contracted COVID-19. It was initially thought that you had to be 65 and over with chronic, with CHF, I have children, or COPD or something like that, some type of diabetes or hypertension. And we've just found that is not necessarily the case. COVID-19 does not discriminate. It's not based on your socioeconomic status. It's not based on your religion. I mean, it's not based on anything. It's just, if you're there, we're going to try to attack and see what we can do. And I think that's one of the reasons why several of the reasons why it has just spread so much and has ran rampant. And I think the biggest problem is because we just did not properly prepare.
Okay. Absolutely. Thank you so much. And thank you for clearing up your credentials, Ms. Migo. I want to touch base on anxiety and depression, especially in this time. I myself, although I have not been diagnosed by the grace of God with COVID-19, but I did experience anxiety, just the unknown, what was next, and I know a lot of people that have had to be hospitalized have not been able to be with their family during that time while they're hospitalized. So, Miss Angie, if you would just kind of expound on, what are some ways that we could cope, or what advice would you give for those persons to cope with anxiety or depression during this time?
Well, it's a challenge because we're not in our typical situation like exercise and going to the gym, right? There's some things that a person could do, but our normal life has been we're in upheaval. So I've been walking a lot for stress, but I think the biggest factor that has been impacting people's stress, the anxiety is going to be there because of the unknown and the uncertainty. That's a challenge for just the human condition, to sit with that. So, and just be at peace. That's just a challenge, right? The worry about your family, if you have like a family member in a nursing home, the added stress of having your children at home. Some people have lost their employment at this time. Others, I've been working remotely exactly 3 months to the day. I have not been in my office since March 17th. And the challenge for me too has been to separate work and personal life. And so I have to leave my apartment and go for a walk and come back and say, okay, I'm home now, and I'm off now. But the biggest thing I think that people can do is to maintain structure in some way. That first week or so, I was in crisis mode, getting my home office set up and my remote access to my computer at work, and trying to figure out what we're going to do, how we're going to do telehealth from home, and just all the new things. So I had a lot of energy dealing with that and trouble sleeping dealing with that. But it's very easy to just roll out of bed and go sit at a computer and you're at work. But you really need to do the same thing, almost the same thing that you did when you were going off to work. Get up at the same time, take a shower, get ready, whatever it is that you do. Now, granted, I've only worn sweats or yoga pants or pajama pants for 3 months, but I'm a little worried about putting anything on with a zipper right now. But structure is key. So that first week I was eating all the wrong things. I got frozen pizzas and gained a little weight, a little more alcohol at this time for some people, just depending on however you cope. The sleeping is important, and just having a set schedule, whether that is at this time I'm going to go for a walk, or at this time I'm going to go sit down and eat dinner with my family and get away from my computer, you know.
Absolutely.
I think that's the biggest thing. The other thing that I find helpful, and you don't need a gym membership or the ability to go to a gym, is meditation and yoga. Powerful things. And it's some people that have never tried that find it very, you know, weird or new agey, or, you know, it doesn't have to fit any kind of belief system though, right? So you can go on YouTube and get a 30-minute, a 10-minute, an hour-long meditation, a guided meditation that will like help you let go of fear, and it'll be a voice that's soothing and walk you through a visualization. And I tend to like the ones that go back to like my inner child, whatever I'm afraid of, it brings me back to my inner child. So the fear that's going on right now, it's causing us to not make to find the best solutions in our day-to-day life, you know, making good decisions for ourselves. So something simple as meditation, it could even be right before you go to bed. Play something on your phone if you have one, or there's yoga videos for stretching, something to do with your family, you know, like, hey, let's all do this stretching video together or something. The other challenge some people have had is living alone and that isolation. And that's been a real challenge. I've found that whatever a person struggled with before this occurred has been exacerbated now. So if you're already have an anxiety struggle, it's way worse right now. And if you had depression, it's worse right now. So at least know you're not alone. And I would say give yourself a break, have some self-compassion. I think a lot of people are beating themselves up for not being as productive as they thought they would be. I should have learned a new language at this time. But, you know, I think we're just in survival mode, and that's okay. You don't have to set like lofty goals right now, because there's so much going on in the world. And, you know, the news consumption is a whole added factor to stress too. It's not gotten any better. It's only gotten worse beyond the COVID news. So learning how to have moderation in all things, news, food, alcohol, get good sleep, you know.
Right.
Yeah, that's a long ramble. I apologize, but
no, that's great information. Thank you so very much. Thank you,
Minister
Elder.
Williams.
Thank you.
I'm sorry.
That's okay. Janie Phillips, Mrs. Janie Phillips. I wanted to hear your thoughts on that with Mrs. Master of Psychology as well. I want to hear, what are your thoughts?
One of the areas that we are forgetting to address is how is the coronavirus, the COVID-19 and all the news and everybody, how is this affecting the children? Because when we talk about anxiety and stressors, we sometimes forget children experience the same anxieties, the same stressors that we experience, and we have various coping mechanisms. But for the child, sometimes there may be changes in their behaviors that we may not understand, simply because we have forgotten that they hear what we say, they feel the tension that we're under, but yet how do they express it, or how do we inform them about our fears or our concerns? And so we need to remember the children hear and listen to us. So for children who are asking questions, we need to answer them on their level so that they can understand this is a dangerous situation that we're in, but we have to do what we have to do to prevent it. For children, washing their hands. And if we do take them out anywhere, they need to mask up and let them know that when they take the necessary precaution, that is a step toward preventing them from getting the COVID-19. the coronavirus. But we have to remember, children hear and they understand much more than we think they do. So we have to consider their stress level also. And I'm not going to be as lengthy because I know there are many topics that we have to cover, but I just wanted to add that in because I also am a child care health consultant for the state of Louisiana. So we need to think about our children and provide for them some stress relievers. Maybe it's exercise, maybe it's going for a walk, maybe it's playing a new game inside, indoors or outdoors, but do something with the children as well to enable them to deal with the stresses of this new enemy that we face, this hidden enemy. Thank you so much.
Absolutely. Thank you so much. We appreciate that response. Yeah, I think a lot too, we need to educate the parents, because I've been in the store many times and saw the parents with the face mask on, but the children without one. And I'm thinking, what in the world, So educating the parents of how important to make sure that their children are masked up as well. Well, moving right along, I hope everyone's enjoying it. Yes.
I do have a question
This
for
is awesome.
Elder Phillips, if that's okay. I wanted to know, what would you guys say and offer to family members of patients who are admitted into facilities, whether it be hospitals, assisted livings, or SNFs? Because we do get a lot of anxious family members for good reason, because they're not able to be there and to be at the bedside. So what would you guys suggest for those family members?
Well, I actually work in a facility where I work in assisted living. And so, of course, we get calls every day of families who are used to visiting with their loved ones, who are just anxious and wanting to make sure that their loved one is okay. And so what we do is just assure them that we're there, we're taking care of them as if they were our own. We've also allowed them to come to the window. Of course, still wearing PPE, but they can come to the window. Of course, the window's not open and they're not exposed, but just to say hello, just to see their loved one and lay eyes on them. And we found that gave them some form of reassurance in this time. Of course, their understanding as well, but just opening that door to just let them see their loved one. We found that that's been helpful in maintaining some form of, being able to see their loved one. Anyone else?
One
You
thing
could maybe call them on the phone or even Facebook.
Yes.
One thing I'd just like to add, and I think Dr. McSharma will be the one to talk about this, is making sure that if you work in the healthcare profession, making sure that you remember and also remind your coworkers about the value of the life of each person you treat. And I've seen Dr. McSharma display this multiple times. And I think that type of mentality can go a really long way in terms of allaying the concerns that family members have and making yourself feel better, and also making your teammates feel better so you don't have burnout. Because family members, and I know this from when I taught a public health class, family members can sense burnout. They can sense when doctors start caring, and that's when you start having problems. And that's when patients can start doing worse when they don't have to be, for non-medical psychosocial reasons.
Absolutely.
Yeah, I was going to say, locally, if you have a family member at our hospital, we have iPads to FaceTime everybody. So if you're not getting the contact that you would like, I mean, it's like 2 iPads, but we're sharing. If you're not getting the contact, if you're a family member who has someone in the hospital and you're not hearing from the doctor or the nurse, and it's been a day or 2 and they've had ample time to call you back, things that you can do are call the nurse and ask to see your family member on FaceTime. If that doesn't work, you can call and ask to speak directly to the doctor. If that doesn't work, please call the patient advocate or the director of nursing of the hospital. And it doesn't have to be malicious or it can just be like, hey, I'm worried about my family member. I need a direct line of communication to my family member and the person that's taking care of them. And sometimes that's what it takes. So I want to tell everyone those 2 things in particular so that there is a way to get the response that you need. I know I personally try to FaceTime every other day. It's difficult when you have so many patients, but have a FaceTime with family members at least once so they know who's taking care of their family member. They see my face. and they also know what the plan is and that I will call if anything's going to change. And most of us try to do our best about that. But if you're not getting that response, those are the people that you need to call in order to get it sometimes. So there are avenues that you can pursue so that you know that your family member is being taken care of well. And every patient should always have an advocate. It makes a difference. Be the squeaky wheel. That's what I do for my family, and that's what I encourage everyone to do. Be the squeaky wheel, because it's worth it. Yeah,
absolutely. Thank you for answering that question, Alicia. That's a really, really good question, and thank you for everyone that's responded. I didn't even think about that, but that's very important, especially it kind of alleviates some of the anxiety that the patients as well as the family are already going through. So that helps out a lot.
So piggyback on what Dr. McSharman said. Sure. And just with being the squeaky wheel, it is very, very important. Mm-hmm. But some other things that people have said, the other panelists have said, is that definitely there is a big possibility of burnout for your healthcare providers. Mm-hmm. That being your CNAs, your nurses, your medical assistants, your doctors, social workers, everybody across the board. So I also want to encourage those family members, do be the squeaky wheel, do ask questions, but I also want to encourage you to please be respectful and also be mindful that we are professionals. However, we are also away from our families and putting our lives at risk to care for yours. And so I believe that if we all just kind of operate with that at the forefront of everything else, it would make for a better situation for all of us, including that family member. And one other thing that I did want to throw in there as far as how I typically deal with anxiety is I do believe in prayer, definitely journaling, just finding positive and encouraging scripture, because there were days when I was just like, what in the world is going on? But it helps to settle the mind and just you as a person and an individual. And for those of us who are working, it reminds us what we're doing, why we're doing, and helping and encouraging us to do it to the best of our abilities. Okay, I'm done. Thanks.
I'm gonna tag on to Alicia now with what she was saying. Journaling is powerful. It's healing, even in the face of grief and trauma. Writing about those feelings, those fears, very powerful healing abilities, and helps you process those things. But also gratitude exercises, like, naming 3 things you're grateful for.
That's good.
3 good things that happened today, those kinds of things at the end of the day when you go to bed. If you make a habit of that, it just increases endorphins in your brain, and neurotransmitters, positive, good feeling neurotransmitters. Those positive psychology exercises, you don't have to go anywhere to do them. You can do them yourself. So I just wanted to tag that to you as well. It's just another self-care kind of thing you can do.
Thank you so much. Attorney Carton, I'm digressing for just a second. As it relates to those employees that have been furloughed, what are some rights, if any, do employees have, once they've been furloughed from their employer?
The first question is, there's 2 forms that rights can take. One is your contractual relationship with your employer. Are you in a union job where there's a certain set of guarantees? Are you in a government job where there's a similar set? And there might be something that is a private law between you and your employer that gives you certain sets of rights. The other thing is that you can apply for unemployment insurance. Now, unfortunately, the $600 addition to unemployment insurance is going to end sometime in late July or so. That can have an impact on a lot of people, and that means that the value of the unemployment insurance being received will decline to some extent. Now, if you are also, the other thing is that if you are, if you have disability insurance, or you have a life insurance policy that might have a disability provision in it, it may include some kind of a subset that gives you some kind of income, makes it up or does something based on quarantine or something of that nature. But it's that one, you're very lucky if you have it. So, but check all your insurance, check to see what you've got going on, and hopefully it'll get better. But I mean, if you're in that situation, also talk to your employer, encourage them to talk to the Small Business Administration, encourage them, be open with your employer. Your employer may not want things to end that way. They may want to work with you if possible. Now, that's an optimistic view, but I think that realistically, if you can, whatever you can do to encourage them to save your job might be a good start.
Awesome. Thank you. Now, what about the businesses? You know, a lot of businesses had to shut down. Are there any type of legal assistance or recovery funds for them, for those that have had to close down?
One of the first things to consider if you're a business is, do you have a general commercial insurance policy? Do you have frequently those will contain a loss of business insurance policy. Now, for some reason, insurance companies have been telling people that they're not covered for this, that there's no provision whatsoever. And in some instances, that might be true. I know that for some policies since 2003, they've excluded coronaviruses since the SARS Classic or SARS-1 in 2003. But they have been, a lot don't. A lot don't include viral exceptions and act as if, well, you don't have a coronavirus policy insuring you. And you're like, what does that have to do with it? It says if there's a shutdown beyond my control, I'm covered. Like, no, it's not. You have to have, it's ridiculous. The other thing that exists is there's a question as to whether, even if there is a coronavirus exception, well, what about when the government told you you have to shut down? That's a separate thing. That's not a virus. That's a government response to a virus. And we can go through that at length. The other thing is getting in touch with the Louisiana Workforce Commission. They can provide resources, advice, assistance for affected businesses. Also, Louisiana Small Business Development Center. And you can also apply for disaster assistance loans with the Small Business Administration. Now, there's a lot of paperwork. There's a lot going on here. Realistically, though, going back to the insurance, that's something that you should reach out to get counsel if an insurance company denies it, get a copy of your insurance policy. Similarly, if you have to make deals with the people to whom you owe money, or you're trying to negotiate something, try to get it in writing. And if it's a big enough deal, meet to an attorney or do something. It's a very big question, but I think that those are the core things to deal with. If there's more specific questions from the congregation, we can circle back to it.
Awesome. Thank you again, Attorney Crichton. I appreciate that. I'm kind of going back to COVID-19 as it relates to prevention. And excuse me if we've already mentioned this. I've heard so many things as far as prevention, of course, hand washing, but as it relates to certain vitamins, of course, vitamin C, vitamin D, zinc. Dr. McShorma, are there any type of vitamins or suggestions that you can make, if there are any, that maybe prevents or slows down the virus, excuse me?
Yeah, I think the ones you mentioned are very important. Vitamins C, A, and D have been very essential in reducing inflammation just in general. A lot of people are low in vitamin D right now because everyone's staying inside, and you usually get it from exposure to UV and sunlight, and it's 2,000 degrees outside. So we're not going outside. But also the really important one that I tell people or in my family that you should have on hand is vitamin C and zinc. Zinc can come in the form of zinc sulfate, but it's also present in many over-the-counter remedies like Coldies and Airborne. And the reason for that is because zinc is proven to help the body with the immune response so that the symptoms aren't as severe. So in the hospitals, we put people on zinc sulfate, 220 milligrams 3 times a day, vitamin C, 500 milligrams 2 times a day. These are things that you can have on hand at your house because they're over the counter, that you should have as like your over the counter COVID battle stations. In addition to that, I also highly recommend things like Pedialyte or sugar-free Powerade or Gatorade, because the other issue is people get dehydrated very quickly, and not to get too vulgar, but when you pee, your urine should be clear or light yellow. If it's not, you need to drink more unless you have a reason that you can't. But those are the most important ones. Of course, the best prevention is hand washing, masks, social distancing, and not getting the virus in the first place. But if you can have those things on hand, it's a really good way to help your immune system battle it naturally, or even maybe decrease your risk of getting it. Of course, that evidence is anecdotal, but that's what I do, and that's what I tell my family to do.
That is awesome. Some of the things you shared, I was not aware of. So I was literally typing them in my phone so I won't forget, so I could share with my family and friends. So thank you for that.
Absolutely.
So as far as recovery time, when should someone get retested for COVID-19? And how long is recovery?
I didn't know if Alicia wanted to say something before we move on to that.
I did have a question, Dr. Sharma. What would you recommend for patients who have hypertension? Because I heard you mention the Powerade and the Gatorade, but oftentimes because of the high sodium intake, it shoots it through the roof.
Yeah, so, I think Pedialyte is milder in terms of how many grams of sodium it has. If you have high blood pressure, your goal is to limit your sodium intake to 2 grams or 2,000 milligrams of sodium per day. So if you can't do that through Pedialyte, then I would recommend just drinking water, because water is really the main thing that your body is trying to latch onto. I mentioned those other replacements because they also have some electrolytes in them, but you could get the same effect by drinking water and eating a banana. So if you have high blood pressure, just do that and keep a close eye on your other levels of sodium intake, like soft drinks and frozen microwave meals. Those are 2 notorious ways that sodium gets into your system and shoots your blood pressure up. But yeah, that's a great question, Alicia. Thank you.
It is.
Yeah,
for sure. Okay, Elder Phillips, you can answer this question for us. And we're almost done here. I'm really enjoying this. I wish you had more time. And Dr. McSharma, Alicia, please feel free to join in and chime in on this question, and even Angie. As it relates to the effectiveness of a mask versus immunity, what is your stance on that? What is the effectiveness of a mask versus immunity, since it is a virus?
Well, we know that this virus is supposedly transmitted, it's airborne. So the mask prevents the droplets from someone who may or even may not be infected, or even a carrier. The mask would prevent that virus from spreading to someone else. It's so utterly important to wear the mask that covers the nose and the mouth, of course. And for medical professionals, we also have the face shield to protect our eyes.
Yes, ma'am. Dr. McSharma, do you feel like there's a difference between wearing a cloth mask versus a regular PPE mask, face mask that we see in the hospital?
Yeah, I have a little show and tell. So this is an N95. This is what we wear in the hospital to help protect us from giving it to people and to protect our patients from giving it to us. This is a KN95. Super cute, right? Which is basically the Chinese standard for an N95, but it's a KN95, but for all intents and purposes, protects against 95% of respiratory particles being transmitted. And yes, it's shaped like this so it won't ruin your lipstick. Very important. Right. This is the next level down from that, which is what most people have, a cloth covering. I thought what Miss Janie said was so important. It's got to cover your nose and your mouth. You're not helping anyone by doing this, walking around, because air is still coming through your nose. I see so many workers in grocery stores doing that, or just pulling it down when they get hot, which I totally understand. So this is, out of the 3, the least effective in terms of stopping all the particles, but it's the most accessible. So what is so important about this is when you wear this mask, you are lowering the chance that you're going to give COVID to someone else. When you're wearing a mask, you're really protecting other people. And we know COVID can be spread asymptomatically, pre-symptomatically, just when you're talking. And so if you wear a mask and you social distance, we know like the chance of you spreading COVID drops drastically with those two measures in place. There's been a lot of debate about how effective masks are, but I feel like if everyone just uses their common sense about it, when you're a child, you're taught to cough or sneeze into your elbow or your mouth because you don't want to give someone your germs. A mask is providing a physical barrier to the respiratory droplets that transmit coronavirus. So there's no way that wearing a mask does not reduce the chance of spreading it. I mean, it's just impossible. Yeah. So try not to listen to the hoopla surrounding it, kind of use your common sense. The last thing I wanted to say about that, and we should probably revisit the recovery question if we have time, is there are so many people just ignoring the protocols, right? Yeah. And those of us who understand how serious and scary this disease can be if you get it, you might feel very frustrated. Like, I can't go to church. I can't go grocery shopping. I can't do things that I want to do because no one else is following the rules. So you have to do what's necessary to protect yourself and your family, because that's all you can truly control. So you've got to know who you're associating with, how serious are they taking about safety precautions. And honestly, what I've told people, since a KN95 is not technically the US standard for medical face masks, you can buy these. Mm-hmm. You need to go ahead and buy a pack of KN95s, and that's what you and your family need to wear when you're in high risk, high populous situations, because if you're going to rely on everyone else to do the right thing, you're going to be waiting a long time.
I think
do what it takes and get the protection that you need to keep yourself safe.
And Dr. McSharma, I think when you say you need to, I think you mean that this is what you would do for your family, correct?
Yes.
You're not giving medical advice to, right?
Correct. That is correct. Yes.
To top on that, our firm requires that in order to enter, you have to wear a mask. We protect our people, we protect our clients. And that's what we're about. The other thing is that there's nothing that really stops businesses 99% of the time from imposing that requirement. So if you are in a position, if you own a business, if you are in a position or you have your leader's ear, feel free to say that. Say, I want to make sure that masks are worn. And also, if your employer tells you to take the mask off, have a serious conversation with them about it. It's recommended that everyone wear masks according to the CDC if they're an employee who has contact with the public. But just as important is customers to be respectful should wear masks when they enter a place of business, especially when there's higher traffic.
That's good information. Thank you so very much. Dr. McSharma, before we end the call, did you want to revisit the question regarding recovery time?
Yeah, the recovery time is so varied. Keep in mind that I'm seeing hospital patients. So if you're sick enough to get in the hospital, you're a little bit sicker than maybe people who are being treated at home. The recovery time can be anywhere from 1 to 4 weeks, okay, depending on how sick you got. Regarding retesting, that's really only beneficial if you are worried that you are still actively shedding the viral particles that can make other people sick. Because the truth is, you can have symptoms. I think we've all had a virus where the cough lingered forever, right? And you just couldn't get rid of that nasty cough. So the symptoms may last longer than your infectious period. So if you're worried, hey, I'm about to go back to work, I'm about to be around people, that's the only time that I would recommend retesting. First of all, it's not a fun test, and there is a margin of error there in terms of its reliability. But second of all, that's really only helpful for knowing if you're shedding the viral particles. But the recovery time based on your pre-existing conditions and how sick you got can be very varied. And so the other reason is I really want to encourage people to take it seriously, because you may survive COVID, but you may not be able to thrive after COVID. You can be short of breath for weeks, or it could be years. You may be on oxygen for much longer than you thought you'd have to be. So surviving COVID is one thing, but whether you'll fully recover and regain the functionality that you had before is a completely separate scenario. So when you see these numbers about X number of people have recovered from COVID and they beat it, remember, they're not telling you how they're doing. They're just telling you that they're still living. So it's another reason to take it seriously.
Absolutely. That is some great information. It's very much so an eye-opener. And I hope the audience is listening in and hearing what you're saying, because even the testing, I know some people are saying that they're not even sure that the tests are accurate because of how they're actually performing the tests. The people that are going by the drive-through testing, are they trained adequately, to be able to do the test correctly and appropriately? So that's another question. So anyway, I really appreciate everyone on the Zoom call. I had so much fun, and I wish we could go on longer. Maybe we'll plan another one soon. Does anyone have any thoughts before we end the call?
I just wanted to share one thing about recovery time. I was speaking with the immunologist the other day, and just as Dr. McShorma said, depending on how sick you were, and definitely afterwards, because a lot of people are assuming, well, you lived through it, so you must be fine. And there are a lot of other things that come along with it that takes a longer time just for the healing process. I do have coworkers, and they are still 2 and 3 months out. They're still having issues. They're still having problems. And just speaking with some of the immunologists here in town, they are having patients that are 3 and 4 months out who previously had no problems, who are on oxygen. I mean, they're still in home. So it's per individual, but one of the things that they said is that it's still just a steady, going on, because there's just so much unknown regarding COVID-19.
Yeah.
And I am so enjoying this, and hopefully we will be able to
Absolutely.
do it.
Very nice. Well, thank you all for participating and sharing your knowledge and expertise. And again, we hope we can do this very soon. And again, I hope everyone stays safe and healthy. And again, we appreciate you all. Bishop, thank you so much for allowing this opportunity for us all to get on the call and allowing us to be on your platform for Praise Temple. We love you all. Again, stay safe, and we'll see you then, hopefully soon. Until then, have a good night.
Good night. Thank you.
Good night. Thank you.